You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says no more dentures. With us, we have an expert on the topic, Dr. Pastiu. Dr. Pastiu, welcome to the program.
Thank you very much for having me.
Now, for people that don't know your center, and I know you brought photos, and we'll get to those, but who's the typical patient? Who's coming in for dental implants?
People who have missing teeth, people with bad breath, people who have broken teeth, people who have dentures and they think that the whole life they have to live it with dentures. People who are looking for something else, people who want something else and they cannot believe that they are still in dentures and those cannot be replaced. Okay. And our practice specializes in giving those people a kind of instant gratification, specializes in giving those people the solutions in one day.
So you do it all right there. So when you say people could come in with no teeth, and at the end of the day, they walk out with a full arch of teeth that don't come in and out.
Yes, we do it every single day in one day. Everything is done in one day.
All right, now let's talk a little bit about your center. Okay, so when it comes to dental implants, how it's typically done is you go to one place that does the surgery, another dentist puts the tooth on top. You may go to imaging somewhere, and then they send it to a lab. You have the lab there, you do the surgery. I mean, you do all those parts. Is that correct?
Correct. This is how it's typically done. Patients go from one office to another. They go to have the digital imaging done, and after they go to a specialist, to an oral surgeon, and after that to another dentist or prosthodontist, and after they go back. So it's a lot of back and forth on these procedures. We do it all in the same day under the same roof.
Now you're also a dental technician that makes teeth.
Yes, I was trained in Romania. I went to school in the same time when I went to school for dental school. I went to school to be a dental laboratory technician also. So I have that license also. I didn't use it too much in Romania, but coming to the United States, it came very handy because I can make the teeth myself.
Okay, good. So it really is kind of a teeth in a day center.
It is.
Same day. Are there a lot of people, and we talked at the top of the show, no more dentures. You say nobody should be wearing a denture.
Correct.
What do you mean by that?
Well, dentures are not comfortable. People who wear dentures, they don't say it to their families or to their friends. The only person that knows that the dentures aren't comfortable is their dentist, if they go to a dentist. But if they don't go to a dentist, they just live an unhappy life and they have a little dirty secret which they hide from the other friends or from their circle.
Okay. Now, are there a lot of people where you are, that have dentures?
At least in my area, there are at least 500,000 people wearing dentures. This amount of people is big, is huge. It's like you can fill 10 Philadelphia Eagles stadiums with those people wearing dentures. So it is a big problem.
Is that right? Well,
yes.
If dental implants are so good, why aren't they all doing it? Why aren't they coming in to do it? What's your take?
Well, Randy, this is my take. From talking to patients and to really asking these questions, this is what I found out. Most of the patients with dentures, they are out of the system. They don't see a dentist for a regular cleaning, for x-rays, you know, how people with teeth do. They are out of the system because they go to the dentist only if the denture breaks or they lose it or it becomes so loose that they cannot take it anymore, and they go really quickly for a reline. They complain to the dentist that the denture doesn't fit, and they are very quickly in and out.
So they don't even know their options.
Exactly. And being so kind of miserable when they go to the dentist, they don't have patience to listen if another treatment is available to them. Another reason why they don't go for dental implants is because they have a chronic fear of the dentist. They went to the dentist all their lives. They had the root canals, they had the crowns, they had the extractions, they had the bridges. They failed, they paid a fortune. So after all this, when they finally had the teeth out, you're happy. They thought, oh, this nightmare is over. It's not
so they don't want to go to the dentist.
They don't want to go to the
dentist. Like if you're wearing
dentist.
dentures or false teeth,
no,
the last thing they want to do is see you.
Correct.
Yes. Do you hear that, by the way? Like
I hear
no
that a lot.
Doctor?
I hear that a lot. Yes.
What do they say?
Well, the moment they sit in the chair, some people say, no offense to you, doc, you seem to be a nice guy, but I hate the dentist.
What do you say? Do you have a funny comeback or anything?
I say, well, thank you for complimenting me, but I hear that a lot and I understand your feelings. Because I hear that a lot. Okay. It's not like I'm just saying that. I hear that a lot.
And you say when it's all done, they like coming to the dentist.
They like coming back. They talk. They joke around the girls at the front desk. They call me by the first name. They send me letters. Sometimes they send me gifts during the holiday season. I mean, it's a totally different perception of the dentist from their side.
But isn't it true though? And we're talking about, I guess, two groups of people: people that want to avoid false teeth can get a fixed set of teeth in one day, but then the denture crowd that can go in and you say in one day you could make the teeth right there on the spot and they walk out with fixed set teeth. But if you've been wearing dentures for 30 years, isn't it true you don't have enough bone to do this?
This is what patients think. They have been told somewhere else, or they self-diagnose, oh, I've been wearing dentures for so long, I must not have enough bone, so I need bone graft or a different, very sophisticated procedure in order to replace the bone in order to be able to have dental implants. But with the advancements in the technology nowadays, we don't need bone graft. We have enough bone in denture wearers to place implants and to give them a new set of teeth, their third set of teeth.
Third set of teeth, you call it.
Correct. Well, when they are kids, they have the baby teeth. And after that, the permanent teeth, or the second set of teeth, they come in. They have problems, they fall out, they have dentures, and I give them a permanent set of teeth, which is exactly like their second set of teeth. And they feel good, they can smile, they can chew, they can live their lives with no worries, they don't come out, they don't get cavities, they don't get gum disease. It's the third set of teeth, and they last for the rest of their lives.
But what about pain? I mean, putting the implants in seems like very painful.
Actually, it is not. This is what people think also, but it is not. I mean, we numb the patients, and the bone where we place the implants, the bone doesn't have pain receptors.
Okay.
So if you put an implant in there, the bone doesn't feel it. But we still give the patients, we numb them up.
But the gums could get sore, right? Yeah. So there is a little discomfort.
Not really. Not really.
Okay.
Not really, because the implant is placed in the bone and all the pressure is in the bone on the implant. So being that the bone doesn't have any pain receptors, the patient doesn't feel it. Yes, it's a little sore, a little tender from the surgical procedure, but most of the patients, they don't need to take any painkillers the next day. Some of the patients, they don't even take the painkillers that specific day of the surgery. Like sometimes I've called the patient and I say, oh, how do you feel? How do you feel today after the procedure, after a couple hours after they are done? Well, doc, I took an Advil just in case. I didn't really need it, but I just took it just in case I'm going to have some pain later. But I didn't have any for the same reason, because the implant is placed into the bone doesn't have any pain receptors. So this is why they don't feel it.
So when it's all done, okay, so they come in, I mean, the day of the procedure, they can come in, and what about the people that need, their teeth removed? You say they've been told their teeth have to go.
Right.
Are you saying on one visit, you could remove the teeth and put the dental implants in, the full arch of teeth, the same day?
Correct.
How soon can they eat?
Right after. They can eat in the office. I can give them an apple. I can give them a slice of pizza. I can give them something to eat and they can eat right away. Yeah, which is very hard for them to believe. This is why I feel so good about this procedure, and this is why I like helping people with this procedure. It's incredibly professionally rewarding. I mean, people come in with loose teeth, bad teeth. We take them out, put the implants in, we put a permanent set of teeth on top of the implants, the same visit within a couple hours. And after that, they can smile. And after that, they can bite from an apple. They're still afraid. They feel like, oh, something is going to break, but nothing breaks. It's incredibly rewarding to see that.
Aren't you a little worried when they're biting out of an apple?
No, I'm not worried, because I've been worried at the very beginning, yes. But now, after seeing that so many times, I'm not worried, because I know how strong the implants are placed into the bone. I mean, those implants are pretty big. They are very strong. They are made of titanium.
Okay.
They're not going to break.
How old can you be to get this, to get dental implants?
There's no age limit. There's no age limit. I mean, you can be 90, you can be 100 years old, you can be in the 20s. I have patients in the 20s. I have patients in the 80s.
80s?
Yes.
Now, are they more likely to fall out if you're 80?
No. The age doesn't interfere with the success of the procedure at all. No interference at all.
There's data to back that up? So that's not a problem?
Absolutely,
I mean,
yes.
Scientific data.
There's research on that, yes. Well, I have patients who are in the 70s, in the 80s. And if you're lucky enough to live to that age, and you have a problem with your teeth, you really want to enjoy whatever is left of your life. So you have the family bringing you food, you have to go to these family reunions, birthday parties, whatever. We want to smile, you want to be part of the world, part of the family. You want to live. If you want to take a picture, you have to smile. If everybody eats it, everyone else at the table is eating something, you want to eat the same food. You don't want to say, "Oh my gosh, I cannot eat that because my denture is going to fall out or my
Do
teeth are
denture
going to break."
wearers really have a tough time eating?
Absolutely, absolutely.
Now, knowing you're coming on the show, I know a few denture wearers. I've never heard them complain.
Well, of
Not
course,
once.
Randy, they are not going to complain to you or to their families or their friends
Okay.
because it's very embarrassing to them. It's very embarrassing for someone to have a denture. It's like a handicap. You are very embarrassed, holds you back. You're not going to go around your denture and say, "Oh, poor me, look at me, I have my denture." They have their little secret, which is they hold back. They smile, they try to put their facial veneer, but when it comes to eating and to really living their life, is a nightmare. Because I know for a fact my patients who were telling me stories before they had this teeth in a day procedure or before they had the permanent teeth on implants, they were saying that, "Doug, whenever I was eating something, I would prefer to take my denture out. I will put my hand over my mouth, I will take it out, put it in my pocket, and eat with my lip down and don't smile at all and just eat soft stuff like starchy stuff."
So when they're at home, they would just take off their denture, really?
Yeah. They put a hand over and they take it out, put it in the pocket. And when they are done eating, they put a hand over again, they put it in their mouth and they smile, This is how the life of a denture wearer is. And there are many other things. I mean, constantly when they bite a little bit on the denture, the pressure of the biting force goes to the gums. So they are constantly sore. And they have to use that denture cream, Fixodent or Polydent or whatever. That cream dissolves in saliva, so they constantly swallow it. So it goes into their stomach, and it's not good. It's not good at all. And they're not going to complain.
So nobody should be wearing a loose-fitting denture?
Absolutely.
So they should all be attached to something. I mean, that's your whole, is that the future, that all denture wearers in the future, whether it's 10 years or 50 years, everybody will get implants or something to snap on those dentures?
Something that they are secured, a permanent set of teeth that is secured to the implants. They are not, those that are secured to the implants, they are not dentures anymore. There's a bridge.
Okay.
The difference between a bridge and a denture is quite significant. But the teeth, the new set of teeth, is secured to the implants.
Now, we talked on the telephone, and you do this all on four technique, where it's 4 implants, a full arch of teeth, and the teeth don't come in and out.
They don't come at all. They don't move.
There's a lot of talk of snap in, snap out.
Right.
You say you don't like that. So tell me about the options for denture wearers.
Well, there are 2 options. One of them is to have 4 implants or 2 implants and to have the snap in and snap out denture, which is better than having a loose denture because the attachments, they keep the denture on the gums without moving too much.
Okay.
It still moves. It still moves a little bit, but not as much. But the best option is the bridge that goes on top of the implants, and those teeth, they never move. They are very secure. They never move at all. But in my experience, in my practice, I'm talking about my professional experience in my practice, most 80% of the people who get these snap in, snap out dentures, within 2 years, they convert to the very permanent set of teeth. The reason is, they tell me, "Doctor, this is a better denture than I had before, but it is still a denture. I still have to go to the bathroom after each meal, snap it out, rinse it out, put it in. At night, I still have to put it in my glass with water. So it is still a denture." The permanent set of teeth, the bridge that goes into the implants and is secure to the implants, they never come out. They become part of their bodies.
So it's like their
So
teeth.
after a few hours, they forget that they have anything done. It's their own bodies. They are part of their own body. So this is the big difference.
Okay. So a fixed set of teeth in one day. And for people just tuning in, we're talking about no more dentures, and also for people that are headed toward dentures. Is that a big part of what you do? That means people that their mouths, because I know I'm looking from a distance, your photos does not look good.
Right.
So a big part of your practice are people that their teeth are failing.
Right.
They're going to come out.
Right.
So why don't you show some of these photos? Because you also say you're changing people's lives in one day.
Correct. The life is very much changed in one day. Within those hours that we do the procedures, I mean, their life could be divided into 2 episodes, before having this and after having this, because after having this, it's like a brand new life.
Good. So what are we looking at?
This is Mike. He had gum disease.
But that's got to be unusual.
It happens to be more often than you think, because those people, they learn how to smile or they learn how to hide it. Even they don't know what's in their mouth. When I show them the picture like this, they say, Doc, I knew it was bad, but is this really me? Yes, it's really you, you know.
So these people just never smile, so you don't
They never
see it
smile,
out there.
they hide it. They're even afraid to brush. They're afraid to touch their teeth. They're afraid to eat because they know there's something is in there very bad. And if they do something in the wrong time, something even worse is going to happen.
What did you do for him?
Well, for him, everything needed to come out. All the teeth, they were beyond being restorable. So we took them out. The teeth were the cause of the infection in his mouth. So once we took the source of the infection out, the gums were becoming healthy. We put the implants in, 4 implants on the top, 4 implants on the lower, and we attach a bridge on the top and a bridge on the lower.
So full arch of teeth.
Yes, on the top and on the bottom, the same day. So this is the result that he had right after.
Oh my goodness.
He's smiling so much that sometimes he keeps his mouth open.
Keeps his mouth open.
And he's a handsome man. He's a very handsome man. And I remember calling him the next day after the procedure. When he came in, let me tell you about him a little bit. When he came in, he was so embarrassed. He said, Doc, I don't think you saw something like this before. Which I hear that a lot from patients because they know something is bad in there. You know, they know that something needs to be done. And he had this feeling of self-blame, like, how did I let this happen to me? Why didn't I go to a dentist? Why didn't I seek for help before? So he was very introverted, and he's a very, very good-looking man. And his wife was saying, well, Mike, don't worry. The most important is that something can be done about right now. So he was saying before that he couldn't go out, he didn't feel like being social, he didn't feel like meeting with his friends, he didn't feel like interacting with people. He had a secret, he had something going on that held him back. Next day after the procedure, it was during the summer, next day after the procedure, I called him to check on him, how you feel, do you have any pain, what's going on? And he said, I heard a noise on the phone. And I said, Mike, where are you? Well, I'm on the boat fishing with my friend at the shore, at the Jersey Shore. You know, when you hear that is, I mean, no, you cannot put a price tag on it. It was, when I heard it, it was like, oh my gosh, what this procedure can do for these people. It's a life-changing event in their lives. Look at those 2 pictures. Look at the difference that this procedure can do for him. I mean, imagine how he lived his life with those teeth, and imagine how he lives his life now with those teeth.
They look real, by the way.
They look very real. They feel his face. You know, he's a good-looking man. He has good-looking teeth. I mean, he has a nice smile. I mean, imagine about his social interaction right now versus what he had before.
Yeah, or even on a job interview.
On a job interview, I mean, he's a contractor. He does his refrigeration work. I mean, he was saying before, Doc, I go to the job and I interact with potential customers, and I never smile and I never want to show. I feel embarrassed because they feel like I'm a low, you know, like a low life person.
All right.
You know, and look at him now.
He looks sophisticated.
He looks sophisticated. Yes,
but
he's smiling. When he talks, he's talking with a full face. He shows his smile.
But you have a lot of these. Like I think you told me on the phone, like every single day in your office, transformations.
Transformations, life-changing. This is a life-changing event. Let me show you this next woman. The very nice person. She comes in with a failing bridge, and she has other bridges failing on each side. Her main issue was intimacy. Lack of intimacy or holding back from intimacy. She didn't say it right away. But at some point in our conversation, because I talk to these people a lot, at some point in our conversation, it came up.
Like kissing and things like that?
Kissing. He said, Doctor, I love to kiss my loved one, but I hold back from it. And when you don't have this situation, you never think about. You and I will never think about. But in that situation, when the bridge is loose and she feels like any wrong movement on the tongue or on the lips is going to make the bridge fall out, imagine how the intimacy could be. So this was her main issue. She had those failing bridges, the other failing bridges, Nothing could have been done about it except to take the teeth out, put the implants in, and give her a new set of teeth on top of the implants. Now look at the result. Those teeth are fixed. Those teeth, they never come out. Doesn't even cross her mind that those teeth are going to come out in any event. I mean, intimacy or eating or drinking or whatever she does, is a sense of security now. Before, everything was very insecure. Now she's very secure with her teeth and her mouth. Randy, let me give you a recap on how this procedure goes. The patient with these big problems, which they think that they are not sure if they can be solved or not, they come in. And I told them, yeah, it can be done. It can be done in one day. They come in, we take the teeth out, we give them implants, we give them a new set of teeth, permanently secured to the implants. They never come out, they never break. And they leave the same day with a new set of teeth, which they can buy from an apple, they can buy from corn on the cob, or from a
so
carrot.
They could eat it like a corn on the cob with their front teeth, or they have to be careful?
They can eat it with the front teeth. Right away, they can eat it with the front teeth.
Like broccoli or carrots, salads?
Yes.
A nut? Could they eat nuts?
Yes. They never come out, Randy. They never break. They are more resistant to breakage than natural teeth. A natural tooth is gonna be more likely to break in these kind of instances than the implants.
So what's the maintenance on something like this? Like when it's all done?
It is the same like regular teeth. They brush, they floss, they use the water pick as a little device which shoots water. And they come to the dentist every 6 months like every other person with teeth comes for their 6 months cleaning. We take a look at them, we do whatever needs to be done, we clean them. They are proud and they like coming to the dentist then because they know there's no problem. People are afraid to go to the dentist because they know they have problems. But after all this is done, they come sometimes with flowers, with coffee.
Is that right?
They come, yes, they bring coffee to the whole staff and they come and they are loud in the waiting room. They laugh.
They're loud in the waiting room.
Yes. And
so the personality comes out.
Oh my gosh. All of a sudden, all these people who are introverted, they are very extroverted.
All right, so
it's a pleasure.
Go ahead.
It's a pleasure to see them, to see their name on the schedule. And I say, oh, Mary's coming back. Oh, Mike is coming back. Yeah. Then they come in and we joke and we clean their teeth and we see them after 6 months again.
And you do it all right there?
Everything is done.
In your office?
In my office, under one roof, every single step.
And you
everything,
even make
including
the teeth
the
right
maintenance.
there. You even
exactly,
make the teeth.
Exactly.
So how it's normally done for people just tuning in, we're talking about dental implants, replacing missing teeth, no more dentures, teeth in the same day. But it does sound like a little bit of an exaggeration in the same day. So if somebody flies in, you've never seen them before, you are saying that they could go in without teeth and that same day walk out with an upper and lower fixed set of teeth.
Randy, they can potentially fly in without meeting me before, or without me meeting them before. They can fly in, I can take a look at them, and I can do the procedure. And in the afternoon, they can take the flight back to their own city.
Like a temporary set of teeth or a fixed set of teeth?
It's a fixed set of teeth. It never comes out. Here's another patient.
All right.
He's an engineer.
These photos are good, by the way.
Thank you.
People need to know, I'm not trying to endorse you, right? But these are good stories.
Yes.
And you like this?
I love it. Randy. I can't wait for the next patient to walk in and to help this patient.
All right.
When they come in and they feel like, I'm not sure if this can be done, doctor. I've been to other dentists and they said that I don't have enough bone, that nothing can be done. And when I hear their story, I know where the whole thing is going to go. I know exactly how the patient is going to look. I know how the life is going to change after my few hours of work. So here's a patient who comes in. His name is John, who had also failing bridge on the top. He had the bridge for a while, and he came with the same thing as Mary. The bridge was moving. And he said, Doc, I know that the bridge is supposed to hold on many teeth, but I know for a fact, I feel it that it's holding on only one tooth. All the other supports of the bridge, they are loose. And it's a matter of days when this bridge is going to come out.
All right.
I mean, he could move it with his tongue. He was doing this. Food was getting under. But food was getting under, he wasn't able to brush in there.
So what do you do for a guy like this? I mean, what are his options?
The same procedure is very, very easy. We took the teeth out, and this is how it looks at the end. And those teeth are secure. Those teeth are secure, they never come out. His life, the quality of life in this kind of instances, it changes dramatically. It's not like a little change, I exercise a little, is a dramatic change. I mean, for a life that has, where they have a chronic infection in your body, and who knows for how long that bridge was loose before he felt that it was loose.
So he was miserable for a long time.
He was miserable.
Most of these people, they put it off, especially guys, right?
Yes, and when I hear from the first doctor or for the first dentist they go to that, not too much can be done, maybe a denture. And they go after for a second consult and they are told the same thing. All of a sudden they get this fixed idea that nothing else can be done. They've already been to 2 people. So after that,
why is it that you can do it and they can't do it? I mean, they've been told elsewhere they don't have a bone. Does it come down to training of the dentist?
Yes.
Okay.
I think it comes down to training, to really looking to...
Because you're known for this, right?
Right,
the same day thing.
Right. And this is why people come to me, because they know that within 1 day, I can give them what they want or what they need.
So how do people hear about you?
Because a lot of people had the procedure done in my office, and after that they told other people, and this is how the word spreads in my community or in my area, that I do this kind of procedures and I can help this kind of people. And being that a lot of people have dentures, or a lot of people have very bad teeth, and they are told that they need dentures, they seek my help.
So no more dentures?
No more dentures.
All in the same day?
Yes, and no person, no human being deserves to live their lives in denture.
Well, good for you. We are out of time. Final message, if somebody's watching this, either they're headed toward false teeth, they don't want false teeth, but they have teeth still, or somebody currently wearing false teeth or dentures, what do you say to them? And they're skeptical. They hear what you're saying, but they're still skeptical.
To seek my help, and definitely I can help them. And I say that with certainty, because I haven't had one person that I turn back. My advice to them is to seek my help, because the age is not an issue. Unless there's an underlying medical condition that doesn't allow dental surgery.
Like uncontrollable diabetes or something?
Yes, or malignancies or different treatments that they are on. Unless there's something really bad like that, they can be helped. They can be helped.
All right. I want to thank you for coming on the show. Good for you. And now your consultations, you say, are free.
The consultations are free. There
And
are no
insurance,
obligations.
unfortunately, does not cover this procedure. Like Medicare, Medicaid does not cover
They
dental
don't
implant.
cover, but the dental insurance covers part of the procedure, which is like taking the teeth out.
And you'll accept or
yes,
look at
yes,
that
we
for them.
work with them, yes.
Okay. Thanks again. Thanks for
Thank
coming on the show. You've been watching The Wellness Hour. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.